is my honor to have all of you here for the global launch of a film we at the Canadian Association of Midwives are very proud of. The title is called Voice, Choice, Change: The Lives of Midwives. We wanted to make a film that shows the critical role that midwives play within a healthcare system and within a community. We wanted to demystify the professional midwife and show the public who they are and why it is so important that we invest in this profession. All of these 4 women are leaders. They're trusted and well-liked in their communities. They're confident and decisive in their places of work, and they're role models to young and aspiring professional midwives.
Someone once said that midwives do far more than just catch babies. The impact that midwives have is not just on pregnancy outcomes, as is often assumed, but extends to newborn care, breastfeeding, family planning, HIV prevention and treatment, gender-based violence, and sometimes also cervical and breast cancer screening. Midwifery, a practice so ancient from biblical times, is seeing a long-awaited increase in global attention.
You hear about midwifery, but from a very old, outdated context that probably isn't accurate and is not reflective of what we do in society today.
Here in South Sudan, only 11% of births are assisted by a skilled birth attendant. We can and we must do better.
The biggest challenges that we are experiencing in South Sudan, one is, as a midwife, we are very few human resource, and we have a number of health facilities that are not even having midwives. South Sudan is a large country where we need human resource to be many so that they can reach to the rural areas to provide the care to mothers.
As you know, Canada, along with Sweden, has been a proud supporter of UNFPA's Strengthening Midwifery Services project since 2012. Under the leadership of the Ministry of Health and in partnership with the Canadian Association of Midwives and others, we have worked together to change the landscape of sexual and reproductive health and increase the number of skilled health professionals, especially nurses and midwives, across this country.
I'm by name Dora Kunda. I'm a midwife, the first branch of WOW Health Science Institute in WOW. I graduated in 2015, then I joined UNFPA, and I'm proud to be a midwife.
What I just want to say here is midwife is not just somebody who attends to delivery, but is actually a counselor for the communities. So Dora is actually an example of the dedication and resolve and achievement. And indeed, she has shown that spirit. She has shown that quality of leadership. And we want our midwives, our students, our young people to just emulate Dora and other colleagues. So Dora, thank you so much.
Today is a great opportunity really for me, Jamie, to express my thanks and appreciation to the people and the government of Canada and Sweden for their continuous generosity. We started from only 9 midwives, and now with the Canadian and Swedish investment and other partners, we have been able in less than 6 years to proudly announce that we have over 800 skilled midwives. Let us continue with this partnership together. It has started, the road is still long, the journey is still difficult, but I'm confident with the outcome of the last 6 years, I'm confident that we are going to get there together.